When I was very, very young, I've eaten snake, and it's delicious.
I eat grass cutter and sometimes antelope. Yes, I've seen people eat crocodile before. I haven't had the opportunity of eating crocodile, but I think it's something I would like to taste.
I eat bushmeat, and the type is grass cutter, and I do eat it because it's delicious.
The issue of going into extinction, I believe that it is the regularity.
Extinction? Wow, I never knew. Because I believe that naturally they reproduce themselves.
The fasting remains. I grew up in the village and we've been eating it since I was young. I never heard of anything of such. So let me say it's a myth, or maybe they just cook it up. But there's nothing like that, to be serious. There's nothing like causing monkeypox or chickenpox or whatever. And people are still eating it today.
Bushmeat, whether it's a grass cutter, snake or monkey, comes in different forms and sizes. Hunters kill these animals in the wild before they are transported to bushmeat markets across major cities like Lagos, Abuja, Port Harcourt and Calabar. It has become a delicacy for urban residents who can afford to pay 14,000 naira for a grass cutter. But as the demand for bushmeat continues to grow, so do the chances of introducing new diseases. Ebola, COVID-19 and monkeypox have all been linked to handling and consumption of wild animals.
If we go a bit into statistics, science tells us that about 65% of human diseases that we have currently amongst human populations originates from animals. Quite interesting how we often fail to see the link between bushmeat and human diseases. In recent times, in the last 2-3 years, it's more glaring, it's in our face. COVID-19 taught the whole world a huge lesson, and it came from animals.
In 2020, COVID-19 brought the entire world to a standstill. Although there were debates and conspiracies about where the virus came from, many believed COVID-19 didn't exist. But more research keeps pointing to wildlife markets as the source of the virus. New research recently concluded that the virus was likely present in live animals sold at the Wuhan seafood market in 2019.
It is common knowledge in our field that over 75% of infectious diseases that are circulating in human beings were contracted from animals. So, and the more wild the animal is, the more the chances of getting 1 or 2 or 3 diseases from it. It is a well-known fact that the Ebola virus was transmitted from bats. It is a very good working assumption up till now that COVID-19 was actually transmitted from an animal. It's an emerging disease. It's not a disease that's been known before. Human beings have been living, and we have known a considerable number of diseases that infect human beings. COVID-19 is new, and from where the suspicion of transmission or the emergence started from, it is said to be a wildlife market. So a good working assumption is that it's emanated from animals. So all we need to do is an enforcement of these laws. If these laws are properly enforced, it will reduce the hunting, killing, and consumption of wildlife drastically.
According to the World Health Organization, 75% of all infectious diseases in the last decade have originated from animals. Ebola, HIV, SARS and COVID-19 outbreaks have been linked to the bushmeat trade. So how do humans contact these diseases?
They did a study of the load of this disease pathogen on certain bushmeats, and they followed this particular bushmeat from the bush to the table. They followed the animal to the hunter's house, from the hunter's house to the vehicle. They did another survey, and they found that the animal had about 35% load of that particular pathogen. So you see, it's growing. All the way to when it got to the table at the restaurant where they sell bushmeat, they found out that pathogen level had gone about 65%. from about 25% in the bush. What happened? It's not as if more diseases came on the animal, no. But the stress of taking the animal from its natural environment through captivity, through the bushmeat market to the table, the animal immune system dropped and then the pathogen level increased.
In Nigeria, urban residents have a growing appetite for bushmeat consumption. But the danger of introducing new diseases hasn't stopped people from eating them. 2 years ago, Wild Aid, an international non-profit on a mission to end the illegal wildlife trade, conducted a survey of 2,000 Nigerians in Lagos, Abuja, Port Harcourt and Calabar, and found that more than 70% of urban Nigerians have consumed bushmeat at some point in their lives. Lagos State has a flourishing bushmeat market in Ekpe, the outskirts of the city. In the past, the state government shut down the market to avoid the transmission of new diseases into the metropolis. But the sellers whose livelihood is dependent on bushmeat sales keep finding their way back there.
I'm right here at Oluwo Fish Market in Ekpe, also known for the sale of some endangered species like turtles and pangolins. Well, the market, as you can see right behind me, is under renovation, and the traders here are making brisk sales, including bushmeat sellers.
At the bushmeat market, I spoke with the bushmeat sellers about the bushmeat trade and why they sell it, despite the risks associated with handling and consuming endangered species.
Ebola kò sí lára ẹran, ṣùgbọ́n gbàtẹ́ dẹ̀ gbérú mọ̀sá pé Ebola. Gbogbo àtọ́ ní Ebola yà wá ń jẹ́ ṣọ́bọ́lọ́ ní. À ń jẹ ẹran gbé ṣọ́bọ́lọ́ là ń jẹ 24 hours. À níkun èmi ta máa ń jẹ. Ó dẹ̀ dùn inú mi dùn pé ẹ̀yin dúdú èmi náà dúdú. Kọ́jọ owó síkà méjèèjì. Àwọn táǹtà bó ṣe àti bá rà dé mi ò ní fọ́ kí n tó jẹun. Mi dẹ̀ fi bẹ́ẹ̀ ní àìsàn Ebola mi lọ sí hospital kan sọ pé bí kíní kan wà lára mi rí.
We blacks, we believe in ourselves a lot. We think black power, we are immune to so many things. But I'll now ask you, where did Ebola originate from? And Ebola is very deadly. And when it came, it shook us to our bones. It originated in Africa. Lassa fever originated in Africa. The current one now, Monkeypox virus, is in Africa. So we're not as immune as we think.
Research has shown, science has been able to prove that there's quite a lot of these diseases that come from animals. So I am very sure that such statements coming from them is more because they are not properly educated enough for them to believe in that. The fact that their forefathers probably did not die as a result of such disease is not established because as at the time the forefathers didn't have so much scientific research tools as we have now to be able to establish the cause of death in so many instances. We have read in history of so many disease outbreaks with unknown etiology. If the outbreaks were now, where we have a lot of scientific tools at our disposal, it's going to be easy to establish that such outbreaks were probably from animals.
Ẹjọ́ ọkọ mi tí mo fẹ́ sọ pé kọ́ máa cancel ẹran ọ̀gbẹ́ yìí torí kò sí ọ̀kẹ́ bá lè fún mi tó lè pay mi kò sí tó lè fún mi tó lè pay mi torí mo tí wọ́n rí lójúmọ́ kì í ṣe mi nìkan gbogbo àtàwà bíi táwa nídìí ẹran ọ̀gbẹ́ táwọn kàkà afẹ́ tó 50 ṣẹ́ mọ̀ èlò náà fẹ́ fún wa ní èdè ní ìgbà mi mò ń lọ ní ojúmọ́ gbà mi mo mú 500 kí la fẹ́ fún mi léde tẹ́ fẹ́ tó fẹ́ ká mi.
So when I tell people that these are reasons why we must stop the bushmeat consumption, the reasons are so many. Disease is on one side. Our livelihood, our survival is also on the other side because when we deplete the natural resources around us, the animals around us, we're depleting the forest dies. I'm telling you, very interesting. It's usually not easy to draw a straight line, but research has shown it. The forest dies, and we're the ones who suffer for it.
Meanwhile, as the world battles to contain COVID-19, Nigeria has recorded new cases of monkeypox diseases in at least 22 states nationwide.
As humans grow in population, we are moving closer to wild animals. As urbanization increases, we tend to claim land that previously used to be forest where these animals reside. And for as long as we do that, we are coming closer to the animals. So it is very classical to say that such diseases will come from relating with wildlife.
In the meantime, out of all the bushmeat available at the market, there is a new appetite for the consumption of monitor lizard. In February, photos of people buying and consuming monitor lizards emerged on Twitter. But what is this new obsession with monitor lizards? Why are people consuming monitor lizards? According to the International Union for the Conservation of Nature, the Nile monitor lizard is the least concerned, meaning their population is still much in the wild. But are monitor lizards harmful to consume? Do they pass pathogens to humans? We ask Abosede Olayemi, a senior wildlife and environmental health lecturer at the University of Ibadan.
When the animal is not healthy, is in ill health, when the animal is parasitized, the parasites live on these animals for survival. So most of the nutrients that are supposed to be deposited as flesh will be taken up by the parasite. And we all know that when the animals are parasitized or they have loads of parasites on them, it impacts on their productivity. It will definitely impact on the general health of the animal and it will affect their reproduction. The man that feeds on the flesh of a monitor lizard that has been infected by pathogens will definitely also get infected through the consumption of the flesh of that infected meat.
It is believed that the continued consumption of bushmeat may see the extinction of some wild animals and the emergence of new diseases like COVID-19 and monkeypox. But to address this matter, experts say, starts with consuming healthy alternatives to bushmeat like fish, chicken and beef, and the relevant authorities implementing and improving on the state's wildlife laws.